You're watching Capital Connection from the Illinois State Capitol.
And joining us now is Illinois Senior Senator Dick Durbin from his offices in the U.S. Capitol. Senator, good to have you with us. I want to start, first of all, with this letter that Illinois Senate President Don Harmon wrote to Congress asking for $42 billion in relief for Illinois, $10 billion of that for Illinois' pension systems, and $15 billion for the state budget. A bunch of other of that money that Senate President Harmon wished could go toward local governments there. It seems that ever since he wrote that letter, Illinois has become a bit of a punching bag, especially in some conservative outlets and from some conservative politicians who have said Illinois has had bad finances for decades. Why should the federal government come to bail us out? So why should the federal government bail Illinois out right now?
Well, Don Harmon is the new president of the Senate. He's my friend of many years, and I wish him the best in his new job. But I would just characterize his letter to me and others as ambitious. He was looking for federal assistance at a level which is unrealistic. And I'm sorry that he made reference to a pension challenge. Many states face a pension challenge. We should not be looking to the federal government at this moment or expecting in the future that it's going to step in and solve these problems. What we need to do is to ask for help for not only our state, but also for local units of government for the actual budget losses that are associated with this current national emergency. That, I think, is realistic. We did it in the first round with $150 billion, a lot of it coming back to our state. And I think we should have another round of funding.
And a lot of that, Governor Pritzker has lauded your efforts in securing some of that funding for Congress. So what is a more realistic ask, keeping in mind that Governor Pritzker on Face the Nation just last week said that when this federal bailout money comes through, he hopes there are not many strings attached in terms of Illinois' discretion, how they can spend those funds. So what's a realistic ask, and how many strings are you willing to consider in terms of how Illinois spends whatever money Congress can come up with for the state?
Well, I think associating the spending with the challenge we are facing is fair and realistic. And to say if there's additional expenses or lost revenues associated with that, that the states can make proof of it and collect. How much? Good question. As I mentioned, $150 billion in the first round with the CARES Act that we passed. The National Governors Association, co-chaired by Governor Hogan, Republican of Maryland, has asked for $500 billion in this next round, so roughly a little over three times the first amount. That may be a little more ambitious than we can achieve, but I think it gives us a reasonable target.
There had been some discussion that perhaps the White House was considering attaching strings based on immigration policy at different states, and if there had been sanctuary cities or states that had protected undocumented immigrants in their territories, that perhaps that might cost them in the long run. Your reaction to that idea?
God forbid we get into a political battle over this. There's so many issues that could come up, whether it's guns or choice or immigration, and the whole thing will fall apart. We have stayed away from that. The original bill that we passed, $2.2 trillion, passed the Senate 96 to nothing. The only 4 senators who didn't vote for it were sick or in quarantine and couldn't be on the floor. We can keep this bipartisan, and we should, if we don't try to introduce other issues and fights as part of it.
Are there any emergency changes or tweaks that Congress can deliver at this time to protect workers who are putting their health at risk right now?
We still need more and affordable protective equipment. I had a conference call with my colleagues from the House, bipartisan conference calls, and we had hospital administrators come on the scene and tell us what they're facing. In Fairfield, Illinois, this hospital administrator said, we used to buy surgical gowns for 22 cents a piece. They now cost between $11 and $20 a piece. So there's profiteering and price gouging going on. We ought to address that. But we do need more protective equipment for home care workers as well as those in meat processing facilities. More than anything, though, if we're going to reopen this economy, and we're all anxious for this to happen the right way, we need more testing, substantially more testing, 3 times what we currently have. We have pleaded with the president, use your authority we gave to you under the law. You can direct that there be production quotas, that companies start moving into the production of more testing equipment. We desperately need that. We all want to move from where we are to the next stage, but we want to do it safely.
Before I let you go, I want to ask you about Governor Pritzker's plan. You sit on the president's commission to reopen America, this sort of task force that includes a lot of your colleagues in the Senate, some in the House. Governor Pritzker just announced Wednesday his plan to reopen Illinois in 5 phases compared to Dr. Fauci's 3 at the national level. Governor Pritzker wants to see at least 28 days of stability or decline on those health metrics before we progress through each phase. Dr. Fauci wanted to see 14 days of decline. So we're looking in Illinois at June 25th as the earliest possible date that any region of the state could have bars or restaurants, for example, open to even a few customers at a limited capacity. Some businesses have said, we don't think we can hold off that long. We may risk bankruptcy or worse. Have you had any conversations with Governor Pritzker, and is this timeline acceptable if some of these regions show stable or declining health factors?
I think the governor was right to divide the state into regions. We all know that the incidence of infection and death has been much higher in the Chicagoland region, and they have to address this issue differently than a downstate rural community. I also realize that the governor is trying to be extremely conservative and careful in his approach. It's been tough enough for Illinois and America to live through this one time, but God forbid that we have to live through it a second time if we guess wrong and reopen too soon. So I can't argue or quarrel with any specific deadlines, but I think the notion of measuring our progress against the number of infections, the number of hospitalizations, and the resources, the medical resources of the region, is a reasonable starting point. And let me just say something else while we're on the subject. We can, as politicians, make all the pronouncements we want, but it takes the people of this state to decide when the economy really will open. We can say everybody's open for business, but when people feel safe to take their families to a certain place to shop or for a restaurant, that's when we'll see the return of this economy. So we need the confidence that whatever schedule we have is one that the average person in Illinois said, that's credible, that's safe, I'm willing to risk my health and the health of my family to move forward.
All right, Senator, has it felt a little funny wearing a mask around the halls of the Capitol?
It's really strange. I mean, I've got this whole group of masks here, ready to put on when needed. And in my office, I don't wear them, but in committee hearings and on the floor, I take them off. But virtually everyone is wearing a mask.
I'm still wondering what trips to the bank look like anymore with everybody walking in. Maybe there's a story there, a follow-up.
I've thought the same thing.
All right, Senator Durbin joining us. Thank you for your time, and we're back in a moment with Congressman Rodney Davis. Stick around.